Welcome to the Culture of Healthcare, Nursing Care Processes. In Part 1, we'll take a closer look at the world nurses navigate every day, the expectations placed on them in clinical settings, the way care is structured and delivered, and the role of privacy laws in shaping their work. We'll also explore the professional and ethical challenges nurses face, balancing patient needs with the responsibilities of the healthcare team. At its heart, this lecture is about understanding nursing not just as a set of tasks, but as a vital process woven into the larger culture of care. This unit, Nursing Care Processes, students will be able to describe what nurses do and how they are trained and explain how clinical engineering ensures the tools and technologies they rely on are safe, functional, and aligned with their training. Discuss the role of certified nursing assistants and how clinical engineering supports their work through devices like lifts, vital signs monitors, and point of care equipment. Identify the settings where nurses work, from hospitals to long term care facilities, and connect how clinical engineers adapt technology support to each environment. And identify nursing care opportunities, including those not involved with direct patient care, and explore how clinical engineering parallels this by offering behind the scenes opportunities that still directly impact patient outcomes. So, what do nurses really do? At the heart of it, nurses provide both direct and indirect patient care. But look closely, and you'll see that clinical engineering is woven through nearly every one of their responsibilities. When nurses deliver hands on care, they rely on infusion pumps, monitors, vital signs equipment. Clinical engineers are the ones making sure those tools are safe, accurate, and ready. When nurses screen and monitor patients, it's pulse oximeters, bedside monitors, and EHR systems. Again, all dependent on calibration, maintenance, and integration handled by engineering teams. Even in procedures from imaging endoscopy, the reliability of that equipment comes back to the partnership between nurses and clinical engineers. Medication administration is another example. Smart infusion pumps and automated dispensing cabinets reduce errors, but only when configured and maintained correctly by clinical engineering. Even writing a prescription is tied to technology. E-prescription systems are part of the hospital IT and device ecosystems. These are kept secure and interoperable by engineers. And when nurses coordinate care or hand off to other staff, those seamless transitions rely on communication systems and EHR interoperability. Again, areas where engineering oversight is essential. Finally, nurses often supervise teams of LPNs, CNAs, and other caregivers. Clinical engineers indirectly support that leadership by making sure all the equipment those teams use is intuitive, safe, and standardized. So the reality is this: nurses and clinical engineers are partners in patient safety. One cares for the patient directly, the other ensures the tools in their hands never fail. Let's continue to our discussions about what nurses do and how their work connects with clinical engineering. Nurses are not only caregivers at the bedside, they are also teachers. Every day, nurses educate patients and their families on how to manage health conditions like diabetes, high blood pressure, and so forth. And here's where clinical engineering quietly steps in. Those home blood pressure cuffs, glucometers, or oxygen systems that patients rely on, well, they only help if they are accurate, safe, and reliable. It's the role of clinical engineers to make sure those devices truly support self care rather than add confusion. Nurses often take health education into the community, leading wellness classes, running screening events, or teaching prevention. Often these involve portable devices like handheld EKGs or ultrasound machines. Clinical engineers work in the background to keep those devices calibrated and trustworthy so the results can be used with confidence. At the organizational level, many experienced nurses advise hospitals or health agencies on patient care practices. Their recommendations are stronger when backed by solid data. Data that often comes from equipment performance, safety records, and emerging technologies. Clinical engineers supply that information and ensure the technology side is represented in those discussions. And finally, nurses contribute to research designing studies, tracking outcomes, or testing interventions. Behind every reliable data set is a set of devices that have been tested, validated, and integrated into the study design. Clinical engineers make sure the research results reflect patient health, not device errors. So, whether it's at the bedside, in the community, in the boardroom, or in the research lab, nursing education and practice are deeply intertwined with clinical engineering. One ensures patients and families understand their health, the other ensures the tools used to manage that health are safe and dependable. Just like physicians and other healthcare professionals, nurses often specialize in specific areas of medicine. A nurse might focus on one body system, for example, the circulatory system, or take on a health problem like cancer. Others specialize by population, caring primarily for children, older adults, or patients in unique environments like schools, workplaces, or even the home. Clinical engineering has a direct role here. Specialty nursing relies on equally specialized technology. A circulatory nurse depends on cardiac monitors, EKG systems, and infusion pumps, all of which clinical engineers maintain. Oncology nurses may use infusion devices for chemotherapy or radiation planning systems that require precision engineering oversight. Pediatric nurses may need smaller scale devices or customized equipment to ensure safety for children. And geriatric nurses often use mobility aids, oxygen concentrators, and monitoring devices that must be reliable in long term care. Beyond the bedside, some nurses specialize in critical care or emergency medicine, environments where ventilators, defibrillators, and imaging systems are vital. Clinical engineers ensure those tools are battle ready with no margin for error. And not all nurses provide direct bedside care. Take nursing informatics. For example, these nurses focus on improving information technologies from EHR systems to data driven quality reporting and patient safety metrics. Their work overlaps with clinical engineers who ensure that hardware, software, and medical device integration seamlessly with those systems. So, whether it's bedside care in the ICU, cancer treatment in oncology, or behind the scenes work in informatics, clinical engineers are always part of the story, providing the technical backbone that allows nursing specialties to thrive. The three main types of nurses you'll find in the U.S. healthcare system and how their work intersects with clinical engineering. First, we have the licensed practical nurse, or LPN. LPNs provide basic care with a more limited scope of responsibility compared to other nurses. Because of that, they depend heavily on safe, reliable, and easy to use equipment. Things like infusion pumps, vital signs monitors, and thermometers. For LPNs to do their jobs effectively, clinical engineers make sure these tools are functional, calibrated, and ready at the bedside. Next are the registered nurses, or RNs, and this is the largest group. RNs are the backbone of patient care. They provide direct hands on care, coordinate with the care team, and rely constantly on technology. Calibrated bedside monitors, smart beds, and the like will prevent things like falls, pressure injuries, and they must be interoperable with electronic health records. All of that depends on clinical engineers working behind the scenes to keep these systems accurate, connected, and safe. And finally, we have the advanced practice nurses, or APNs. These nurses have the most education and the highest level of responsibility. APNs can prescribe medications, manage complex cases, and make high level clinical decisions. They often use advanced diagnostics and therapeutic tools, devices like ventilators, dialysis machines, and imaging equipment. Clinical engineers play a crucial role here too, ensuring that these sophisticated technologies not only work properly, but also integrate seamlessly into the clinical workflow, supporting safe and effective care. So, whether it's an LPN checking vital signs, an RN coordinating care, or an APN managing a complex treatment plan, clinical engineers are woven into the story, making sure the technology they depend on is reliable, safe, and trustworthy. Also look at the licensed practical nurses, or the LPNs. LPNs play a key role on the front lines of healthcare. They provide direct patient care, often helping patients with basic needs and self care, and they administer medications depending on their state's licensure rules. They're the ones checking vital signs, monitoring patients closely, assisting with procedures, and documenting everything in the medical record. And because patients and families need guidance, LPNs are often the ones doing the teaching, explaining how to manage conditions at home. What's important to know is that LPNs must work under the supervision of an RN or a physician. They're licensed professionals, but their scope of practice is defined at the state level. For example, in some states, there are limits on which medications they can administer. Now, here's where clinical engineering enters the picture. Nearly every one of these core tasks, whether it's checking vital signs with a digital monitor, administering medications through a smart infusion pump, or documenting into an EHR system, it relies on technology. Clinical engineers make sure that technology is reliable, safe, and ready to use. Without proper calibrated monitors, maintained pumps, and functioning documentation systems, the ability of the LPNs to provide accurate care is compromised. And depending on whether they work in hospitals, nursing care facilities, doctor's offices, or outpatient centers, LPNs sometimes extend beyond direct care into roles like appointment scheduling, patient admission, and even working with information technology systems. Here, too, clinical engineers support them by ensuring that those IT and device systems run smoothly and integrated into the workflow. Interestingly, if you're in California or Texas, you won't hear the term LPN. You'll hear licensed vocational nurse, or LVN. Different name, same essential role. So whether they're providing bedside care or stepping into supportive administrative functions, LPNs depend on both technology and the teams that maintain it, clinical engineers included. Key steps to becoming a licensed practical nurse, or LPN, in the United States. The journey begins with completing a state approved training program, which usually takes about 1 year. These programs are often offered at vocational schools and community colleges. During that year, students split their time between classrooms, learning science and nursing fundamentals, and hands on supervised patient care in clinical settings. After completing their program, students must take the National License Exam for Practical Nurses, known as the NCLEX PN. Passing this exam is a critical step. It confirms that the graduate has the knowledge and skills required to provide safe, effective care. Finally, in order to practice in their state, graduates must meet all of the state's specific licensure requirements. These can include passing a background check, submitting proof of high school graduation, or other documentation. So the path to becoming an LPN is focused, structured, and designed to prepare graduates for the essential roles they'll play in direct patient care. Nurses or RNs make up the largest segment of the healthcare workforce. In fact, back in 2014, there were about 2.7 million RNs employed in the U.S., more than any other healthcare profession, and the demand keeps growing. U.S. Bureau of Labor Statistics projects a 5% growth for registered nurses over the period of 2024 through 2034. RNs receive more education and carry more responsibility than licensed practical nurses. They're the ones planning patient care, administering medications, and delivering therapies. They keep meticulous records to ensure continuity of care beyond treatment. They also play the role of teacher, helping patients, families, and even the public understand how to prevent or manage medical problems. RNs consult closely with doctors, ensuring that patient care decisions are informed and precise. And as leaders, they manage licensed practical nurses, certified nursing assistants, and other healthcare staff. For many LPNs, advancing to become an RN offers broader career opportunities and greater responsibility, making it a natural next step in their nursing journey. Let's talk about where registered nurses or RNs actually do their work. The largest group of RNs still works in hospitals, medical surgical floors, emergency departments, intensive care units, you name it. Hospitals are where many nurses begin and spend their careers. But hospitals aren't the only place you'll find them. Many RNs work in doctors' offices and ambulatory care clinics, supporting outpatient procedures and follow up care. Others go directly into the community, providing home health care services or supporting patients and families through hospice. RNs also play a huge role in nursing care facilities, working with long term care and elderly patients who need constant support. In addition, you'll find nurses in workplaces helping employers manage employee health or in schools ensuring that students receive the care they need to thrive. And don't forget, the military also relies heavily on RNs. They provide critical care for service members at home and abroad, often in high pressure environments. So, whether it's at the bedside in a hospital, in someone's living room, a classroom, or even on the front lines, registered nurses are everywhere delivering care, education, and compassion wherever people need it most. People think of nurses, they imagine bedside care in a hospital. But today, nursing careers extend far beyond that image. Nurses are now seen in some of the most influential roles in healthcare administration and management, taking on positions like Chief Operating Officer, Chief Executive Officer, or even Chief Information Officer. Their clinical insights brings a vital perspective to leadership. Nurses also play a key role in public health, designing and implementing community based programs to improve population health. You'll find them in insurance companies and analyzing care patterns, and even in legal firms and pharmaceutical companies, where their expertise supports cases and innovations. But perhaps one of the fastest growing areas for nurses is in health information technology and informatics. As healthcare becomes increasingly digital, nurses are embedded in provider settings, consulting firms, software vendors, and technology companies. They help design and optimize clinical systems that align with the realities of patient care. This shift underscores a critical truth. Technology alone can't transform healthcare. It needs the voice of clinicians, nurses included, who understand the workflow, the patients, and the context. And this is where clinical engineering overlaps, ensuring that these systems not only function but truly empower clinicians to deliver safe, effective, and meaningful care. Licensed practical nurses, registered nurses, or RNs must follow a three-step process to begin practicing in their state. But here's the difference: the educational path is longer and more rigorous. Becoming an RN typically takes between 2 and 4 years. Students may pursue an associate's degree in nursing through a 2 year program, or they may go further, earning a Bachelor's of Science in Nursing through a 4 year university. In the past, nursing education was often hospital based, but over time it shifted into academic institutions with stronger foundations in science and evidence based practice. Training goes beyond the classroom. Students spend a significant amount of time in clinical settings, hospitals, clinics, or public health departments, where they receive supervised, hands on experience in the caring for patients. Once the academic requirements are complete, students face their next milestone, a national licensing exam designed specifically for RNs. Passing this exam demonstrates that they are ready for the practice. Finally, they must meet any additional requirements their state sets, such as background checks or verification of academic credentials. Only then, with both their education and licensing complete, can they begin practicing as a registered nurse under a state license, ready to step into one of the most vital roles in healthcare. Advanced Practice Nurses, or APNs. These are registered nurses who go beyond the standard training to specialize in advanced roles. Depending on their path, APNs take on very different responsibilities. Some become certified registered nurse anesthetists, delivering anesthesia during surgeries and procedures, a role requiring precision and trust. Others become certified nurse midwives, guiding patients through gynecological and obstetrical care, often serving as a primary provider during childbirth. APNs can also work as nurse practitioners, providing direct care, diagnosing conditions, prescribing medications, and managing long term health. and some choose the path of the clinical nurse specialist, combining patient care with research, advancing knowledge, and improving outcomes across entire patient populations. In many ways, APNs bridge nursing practice and medical expertise, expanding the reach of the healthcare. And just as with all advanced practice roles, their work is supported by a foundation of safe, reliable medical technologies, a space where clinical engineering quietly ensures that the tools they use function exactly as intended. Advanced practice nurses, often called APNs or advanced practice registered nurses, take nursing to the next level, but the path to becoming one is a little more demanding than the RN track. It all begins with step one, earning an RN license and building real world experience as a registered nurse. This foundation is essential because APNs need the depth of understanding that comes only from clinical practice. Next, aspiring APNs must earn a master's degree or higher in nursing. This advanced education prepares them for specialized roles, whether that's a nurse practitioner, a nurse anesthetist, a nurse midwife, or a clinical nurse specialist. Finally, to practice legally, they must meet all state specific requirements that can mean additional exams, certifications, or proof of advanced training, depending on where they live and work. In short, APNs are not just registered nurses, they are highly trained professionals who combine advanced clinical knowledge with leadership and often independent decision making. And just like their practice requires reliable systems, their advanced training depends on the trust that healthcare technology, kept safe and functional by clinical engineers, will always support their work. Let's look at how that path for advanced practice nurses compares to the path for clinical engineers. For APN, step one is to earn an RN license and gain real world experience. In clinical engineering, the equivalent is earning a bachelor's degree in any of the engineering fields and applying those skills in hospital settings, internships, or early career roles. Currently, there aren't very many biomedical or clinical engineering degree programs in the US. That hands on exposure, though, is essential to understanding how technology fits into patient care. Step two for nurses is earning a master's degree or higher in nursing to prepare for the specialized roles. In clinical engineering, many professionals pursue advanced degrees, certifications, or focused training such as a master's in clinical engineering, biomedical engineering, or even healthcare administration. These programs often include real world residencies that mirror the advanced clinical practice hours required in nursing. Step three for APNs is meeting state specific requirements to practice, often involving exams and additional certification. For clinical engineers, while there isn't a state licensure process, there is a professional certification, the Certified Clinical Engineer, offered through the ACCE and the U.S. Board of Examiners. This serves as a recognized mark of expertise. Just like nursing boards, this credential demonstrates advanced competency, professionalism, and the ability to practice at a higher level of responsibility. So while the paths look different, the philosophy is the same: foundational training and practice, advanced education for specialization, and credentialing to prove expertise. Both careers build trust in their ability to serve patients and the healthcare system, whether through direct care or through the safe, reliable technology that the care depends on. As a profession built on lifelong learning, clinical engineering follows the same path. For nurses, continuing education is a requirement. It keeps their knowledge fresh, ensures compliance with evolving standards, and allows them to pursue specialty certifications through exams from approved organizations. This process doesn't just meet regulatory needs, it builds trust, expertise, and ensures the best patient outcomes. In clinical engineering, the parallel is clear. Clinical engineers must also pursue ongoing education to keep pace with rapidly advancing technology. Certifications like the Certified Clinical Engineer or specialty training in any of the areas such as cybersecurity, health IT, or imaging systems mirror nursing specialty exams. They validate expertise and provide assurance that engineers can manage complex systems safely and effectively. The connection here is powerful. In both fields, continuing education is not an option. It's a professional responsibility. It's what keeps patient care safe, systems reliable, and teams confident that the people supporting them, whether at the bedside or behind the technology, are equipped with the latest knowledge and skills. Practitioners or NPs can go beyond their core training by earning certifications in specialty areas of care. These certifications, offered by the American Nurses Credentialing Center or ANCC, show that an NP has advanced knowledge in fields like acute care pediatrics, psychiatric health, and more. Now, here's where things get interesting. In some states, nurse practitioners can practice entirely on their own, making diagnosis and prescribing treatments without a physician's oversight. In other states, they're required to collaborate with or be supervised by a physician. So the scope of what an NP can do varies depending on where they work, and it's the state licensure process that sets those boundaries. At the end of the day, certification helps NPs expand their skills, but licensure determines just how independently they can put those skills into practice. Clinical nurse certifications. The American Nurses Credentialing Center, or the ANCC, offers certifications across a wide range of specialties. These certifications allow nurses to demonstrate expertise in focused areas of care, such as adult health gerontology, home health, psychiatric and mental health, across the lifespan, and pediatrics, and public or community health. These certifications matter because they help ensure that patients receive care from the nurses who have gone beyond the basics, nurses who have mastered specialized knowledge and can apply it in practice. And here's an interesting connection to clinical engineering. Just like nurses pursue specialty certifications to ensure their skills are current and validated, clinical engineers also benefit from certifications in fields like healthcare technology management, informatics, or systems integration. Both paths emphasize the same idea: ongoing learning and verified expertise that helps raise the standard of care and ensures safety across the healthcare system. Specialties extend far beyond the bedside, opening doors into highly focused and impactful roles. For example, some nurses dedicate themselves to cardiac rehabilitation, helping patients recover strength and confidence after heart events. Others take on case management, guiding patients through the complex web of treatment and services. In college health, nurses support young adults navigating their first real independence, while genetics nurses work at the cutting edge of science, connecting family histories and medical care. Informatics specialists bridge the gap between nursing and technology, improving the way data supports decision making. There are also roles in medical surgical nursing, the backbone of hospital care, as well as nursing executives, who lead teams and shape healthcare policy. And specialties like pain management and perinatal care, working with newborns and their families, show how deeply nursing can touch the most personal aspects of life. Here's where clinical engineering parallels emerge. Just as nurses specialize in patient populations or technologies, clinical engineers specialize in areas like imaging systems, surgical devices, patient monitoring, or health IT. Both professions recognize that healthcare is too vast for generalists alone. Specialization sharpens skills, improves outcomes, and keeps innovation aligned with patient needs. Progress in their careers. Many pursue advanced degrees to expand their opportunities and take on new responsibilities. A master's degree allows a registered nurse to become an advanced practice nurse, provided that they meet the other requirements like licensure and clinical hours. This opens doors into specialties such as nurse practitioner, nurse anesthetist, or nurse midwife, roles with greater autonomy and impact. At the doctoral level, there are two main paths. The PhD in nursing prepares nurses for research and teaching, shaping the future of the profession through evidence based education. The Doctor of Nursing Practice, or DNP, emphasizes advanced clinical practice, leadership, and management, focusing on applying knowledge to improve patient outcomes and healthcare systems. Here's where the parallel with clinical engineering is striking. Just as nurses move from bedside to leadership or research to advanced degrees, clinical engineers can pursue master's or doctoral degrees that focus on innovation, health technology assessment, or systems leadership. These advanced programs prepare engineers not just to maintain technology, but to drive how technology integrates into healthcare delivery, policy, and patient safety. Seeing how nursing roles stretch far beyond the bedside. Nurses are caregivers, teachers, researchers, and administrators, balancing hands on care with the systems that support it. Specialization gives them expertise in focused areas of medicine, whether it's pediatrics, critical care, or informatics. But at the heart of it, nursing is a profession built on preparation and accountability. Every nurse must complete formal training, pass a national licensing exam, and meet their state's requirements before practicing. And once they begin their careers, the learning doesn't stop. Continuing education, specialty certifications, and advanced degrees keep nurses at the cutting edge of medicine. Here's where clinical engineering parallels nursing. Just as nurses must stay licensed, engineers in healthcare must keep up their technical expertise sharp through certifications, ongoing education, and advanced training. Both fields demand a commitment to growth because healthcare changes fast. Technology evolves, patient needs shift, and safety is always on the line. So, whether you're a nurse or a clinical engineer, your role isn't static. It's dynamic, adaptive, and built on a foundation of lifelong learning.